Hello everyone, I am Rana or Herazaga, presenter 2 of Group H. So my topic is all about visual impairment. Visual impairment is a general term used to describe people who cannot see even with correction. So there are some people who are visually impaired by birth, or shall we say they are inborn. But there are some people may lose their vision due to some illness or a disease. Individual with Disabilities Education Act or the IDEA explain more about impairment in vision that even with correction adversely affect an individual educational performance. So IDEA includes this kind of problem. So visual acuity. When we say visual acuity, which means sharpness of vision measured by the ability to discern letters or numbers at a given distance. So this is the example of visual acuity. If some of you here planning to go in an eye clinic, because of some reason, you will see this kind of chart or a picture. So second one, visual field. And lastly, perceiving the color. Um, the classification of visual impairment. Blind, number 2, partially sighted, and number 3, deaf blind. So legally blind or minimal light or for perception, it has 20 over 200 vision. To be considered as a legally blind, you must meet one of two criteria for visual acuity and visual fields. Number 2, those who are partially sighted, it is a limited perception with the environment. They also use their sense of touch and hearing as the way to learn about their environment. An individual considered as having low vision, he is still a remaining vision that he can use with the help of prescription or non-prescription devices. Number 3, deaf blind. It is a limited vision uh, and hearing, commonly the individual who cannot read a book or a newspaper at a normal distance while using their eyeglasses. That is why they are called deafblind. Braille and sign language are both used to train these individuals. But later on, we will discuss about the Braille and sign language. The causes of visual impairment. So what are the causes of visual impairment? Before that, let us define first the cause or the causes. So cause is something brings about a result or trying to find the action of the accident. So there are 12, I think, causes of visual impairment. Number 1, myopia. 2, hyperopia. 3, astigmatism. 4, cataracts. 5, glaucoma. 6, diabetic retinopathy. 7, retinitis pigmentosa. 8, Usher syndrome. 9, macular degeneration. 9, retrolental fibroplasia. 11, optic nerve atrophy. And number 12, ocular albinism. So if we talk about myopia, it is a nearsighted. A person can see clearly if the object is close to him. As a result, a beam of a radiant energy of light from a distant object are not focused on the retina. So if we have nearsighted, we also have a opposite of nearsighted. So which is a hyperopia or the far-sightedness. An opposite of myopia or nearsightedness, it is a person can see clearly if the object is far from him. Both children and adults can be affected by hyperopia, and that can be a hereditary. For example, whose parents are farsighted, there are also the possibility that his or her daughter or son may be affected. In this condition, the light rays near the object are not focused on the retina. So let's proceed to number 3, which is the astigmatism or the blurred vision. A person sees blurry image of the things around him due to the curve in the cornea or lens. As a cause, the curve may prevent light rays from focusing the retina, just like myopia, hyperopia, and astigmatism can be through the eyeglasses and contact lenses prescribed by the ophthalmologist or the optometrist. Yes, if you have a symptoms about astigmatism, you need to go to your ophthalmologist to check your eyes and prevent from a severe illness. Also, if your eye doctor will immediately give you an eyeglasses that is fit for you. But do not buy in a change for a fashion because it will damage your eye in the end. Or let us proceed to number 4, which is the cataracts. When we say cataract, it is a person with this condition experience a blurred, distorted, or incomplete vision due to the cloudiness of the lenses because of the trauma or old age. So most of the people who are visual impaired, just like our Lola and Lola, um, they experience this kind of cataract because their eyes are getting blurred since they are old. Or sometimes we see our Lola and Lola wearing the eyeglasses because their cataracts are getting blurry. Since the lenses of opaque or cloudness, this blocks the light needed to see clearly. The person can be photophobic. So when we say photophobic, this can be affected people of all ages. So we are not exempted. Experience serious glare problems or squinting. So number 5, glaucoma. It occurs when the aqueous fluid fails to circulate properly. Number 6, diabetic retinopathy, or from the word itself, diabetic, individuals are affected with this eye disorder. It occurs when there is hemorrhage and continuous growth of blood vessels in the retina. It often is treated with laser surgery. So number 7, retinitis pigmentosa. A gradual degeneration of the retina, it can result to night blindness, photophobia, and loss of macular or muscular vision. So sadly, this condition is inherited and not treatable. Number 8, Usher syndrome. So when we say Usher syndrome, it is a deaf blindness condition which is a combination of congenital deafness and retinitis pigmentosa. So when we say congenital deafness, it is a hearing loss that is present at birth or hearing loss at birth, developed at childbirth, or is in the genes at birth. So the child develops a hearing loss as it grows and gets older, while the retinitis pigmentosa or the RP is a group of rare eye diseases that affect the retina. So number 9, macular degeneration. It is a condition is a typically to adults, but it can also affect for the young. So we are not exempted here. Due to deterioration of central area of the retina cones, visual fields are lost by that the person can use his peripheral vision. So number 10, retrolental fibromatosis or typical to premature babies who are overexposed to the oxygen in the incubator. So 11, optic nerve, optic nerve atrophy, damage of the optic nerve. Optic nerve carries images of what the eyes sees to the brain. So lastly, ocular albinism, a genetic that primarily affect the eyes. This condition reduces the coloring or the pigmentation. So next, we tackle about school-based program. We all know that in the Philippines, there is school for the deaf, and I know we tackle this last time, right? So this is the Philippine School for the Deaf and Blind in Pasay City. So it specializes in teaching students with such a condition. Special education teachers who will teach students with vision loss needs and intensive training using the Braille. So a tactile aid. So what is a tactile aid? So number 1, Braille. Braille is the first school of the blind is Deaf Institute, National Deaf Juanes Avigles in Paris. So it established by Valentin Haoy in 1784. So they used Roman letters and night writing codes to teach students with a vision loss. So the one of the Haoy student names, I know that we are familiar this person. So this is Louis Braille. Um, Louis Braille developed his embossed dots as a communication. During the 1880s, Braille's communication system was not accepted by educators. So Braille is the number one source of literary for the blind. It is consists of patterns of 6 possible dots arranged in 2 columns or 3. The combination of that indicates the letter or the alphabet. So according to Gargiulo 2009, um, there are two or there are grade 1 and 2 braille. So this is the example. This is a grade 1 braille, which means the alphabet is introduced, each letter of the word is spelled out using the braille letter. So next, the grade 2 braille, abbreviation similar to a shorthand used by secretaries. So number 2, tactile aids is a brailler. So when we say brailler, often used by a younger students to learn how to write a braille. So it looks like a typewriter, this one, with 6 dots. A special paper is needed to punch the ray. So this is a typewriter or what we call a brailler. So number 3 is the slate and stylus. So this device is often used by the older students. So the braille dots are punched by hand on a special paper. This is more convenient because it is small and quicker than braille. So this is the example of slate and stylus. Number 4, I mean, this is our there is the other example of slate and stylus. So this is tactile experience book, embossed maps and diagrams, and lastly, the three-dimensional model. Number 4, orientation and mobility program. This is important to teach our student with visual impairment to be aware of his environment and to learn him to move safely and efficiently from one environment to another. So, oh, teacher can give a child an obstacle course where he can practice moving within the environment and gain control of the uh, situation. So, cane. So, what is cane? So, this is the example of cane, a songkod for our lolo and lola. This is very important for individuals who have vision loss and who have traveled alone. Serve as their guide in walking, which can give them an insight about the environment. They can gain information if there are obstacles such as bombs, open manholes, doors, and travel surface. So number 6, a sighted guide. So what is this sighted guide? It is a teacher should demonstrate to sighted student how they can assist their classmate who has a vision loss. However, this should be done moderately. Only the blind person is new in an environment to avoid dependency. So, which means that this uh, person is the uh, teacher. So there are 6 techniques and also that one. So there are 6 techniques to the sight technique. So letter A, greet the person in a normal voice and ask him if you can help him. So um, we should not uh, what we call this one, higher our voice because they are so sensitive persons. So number 2, let him take your arm by holding the part about your elbow. So like this one in the picture. Third, walk in a normal voice and describe if there is a curb, stair door, or other obstacle along the way because they are also uh, examined. Number four, when sitting, place the person hand on their chair and let him sit alone. So number seven, it is a guide dog. So this is the guide dog. So dogs are trained to follow several basic commands and they wear special harness to guide the person with vision loss to travel along in complicated roads. So I think this is a golden retriever dog. And no. So be manipulated. So Cranmer abacus. When we say Cranmer abacus, abacus is helpful for a student with vision loss practicing a number of concepts such as counting and making calculations such as adding and subtracting by manipulating the bid. So I know that we are familiar this kind of devices, right? Because we have this kind of Cranmer abacus in our elementary years. So number three, talking calculator. So an electronic calculator that performs most operation of standard calculators, but the only difference is that it talks. It announces the interest of the result and the mathematical operation at the same time. It presents entries as the result of mathematical operation and sometimes the result and mathematical operation and same time it presents entries of the result and the mathematical operation at the same time it presents the digit visually on the screen. Aside from the talking calculator, students who are blind can also talking clocks and spelling aid to help them in their learning. So number four, uh, optical devices used to accommodate students with low vision. So these are the optical devices, the eyeglasses, contact lenses, so these are contact lenses, magnifier, telescope, and the large materials. So the technological aids. So when we hear the word technological aids, closed circuit television, or I know we are familiar with CCTV, right? So this is a device is a particularly helpful for students with low vision to read on printed text. A television camera is placed above the book or any printed materials. The zoom lens of the camera can help make text appear a bigger television screen. So number two, Optocon. So what is this Optocon mean? So this is Optocon. It is a small handheld electronic device that converts regular print into a readable vibrating according to Howard 2009. For instance, when uh, when Optacon is held over the printed S, the person can feel at the tip of his hand. The graceful curve of S is going to the left to the right. And a download a stroke. So this is the example of Optacon. So number three, the Corswell 1000. So what is this Corswell 1000? So this is a machine has an optical character recognition system that read printed on electronic messages, or this is looks like a tablet. Yes. Another high-tech technology aid is the braille and speech. So what is braille and speech? So this is the example of braille and speech. It translates braille into speech or print. Additionally, there are also an available braille keyboard. So this is a braille keyboard. And also this is an example of braille printer for people with vision loss. Or some braille printers can print braille and text for format from digital text. So number four, lastly, It is an electronic travel guide. So what is this kind of electronic travel guide? So I know this is so familiar to us if we are going to if we are going to the other places or other location that we are not familiar. So this is a GPS, a global positioning system, or GPS, can announce to the user where his location control. Canes with laser beam can convert the light into the sounds or vibration. It can alert the user if there are obstacles along his path. So that could be the end of my discussion, and I hope you have learned something. Thank you and God bless. Bye bye.